Okay, students. So now let's continue with the ventricular septal defect discussion. Okay. So what are the clinical manifestation of ventricular septal defect? Okay, the clinical manifestation of ventricular septal defect are dyspnea. Dyspnea is nothing but a difficulty in breathing. Next one is tachypnea. Tachypnea is nothing but a increased respiration rate. Okay, and tachycardia. So this dyspnea and tachypnea is because of pulmonary edema. Okay, and tachycardia is nothing but a increased heart rate. That is a pulse rate more than 100. Okay. Next one is recurrent respiratory tract infection. So this recurrent respiratory tract infection is because of pulmonary edema. Okay. Next one is shortness of breath. Again, it is because of pulmonary edema. Activity intolerance. So activity intolerance is because of decreased cardiac output, decreased stroke volume cardiac output, and decreased peripheral tissue perfusion. The child will have a activity intolerance. It does not tolerate the activity like other normal children. Next one is peripheral edema. Peripheral edema is because of backflow of blood from right atrium to the superior vena cava and inferior vena cava. Okay, so there will be peripheral edema. And next one is fatigue. Fatigue is again because of decreased peripheral tissue perfusion and failure to thrive. The child is unable to develop adequate height and weight. It is because of decreased peripheral tissue perfusion. And we can also notice there is high pitched harsh systolic murmur. It is because of shunting of blood from left ventricle to the right ventricle. Now, what are the diagnostic evaluation? How to diagnose this disease condition? So, first one is history collection. So, we can collect the history from mother. That is whether mother used to have any drugs. Okay, whether mother had any infection during the first trimester of pregnancy. Whether mother is suffering from any insulin dependent diabetes mellitus. Whether there is any delayed labor or there is a prolonged labor. Okay, or the baby is having any problem to establish respiration after the birth. Okay, all those fetal hypoxia, fetal asphyxia, okay, maternal insulin dependent diabetes mellitus, okay, teratogenic drugs, teratogenic infections, all those information can be collected during the history collection. And physical examination. So we can do physical examination of the child, okay, and thereby we can come to know about tachypnea, that is increased respiration rate, tachycardia, increased pulse rate, okay, or heart rate. And we can also notice there may be on auscultation there will be harsh systolic murmur will be there because of shunting of blood from left ventricle to the right ventricle. And we can also see there is a no proper development of child, no proper height and weight development of the child. Okay. And next when you do a chest x-ray, we can come to note that there is a right sided heart enlargement. It is because of shunting of blood from left ventricle to the right ventricle. Okay. And when you do a 2D echo, okay, 2D echo will able to notify that the shunting of blood from left ventricle to the right ventricle, and it also gives rise to that is decreased cardiac output, that is decreased systolic ejection fraction. Okay, and right sided heart enlargement can also be notified by 2D echo. Next, we can also do cardiac catheterization. Cardiac catheterization means we will insert the catheter. Okay, we will insert the catheter from the femoral vein to the inferior vena cava, and then the catheter is advanced. Okay, so we insert the catheter. What do you do here? We insert the catheter. Okay, so we insert the catheter from the femoral vein to the inferior vena cava. Catheter is advanced to the inferior vena cava, and then the catheter will enter into the right atrium. Okay, so in the right, once the catheter is entered into the right atrium, the catheter is tipped with a pressure sensitive transducer. It will notify how much pressure is there in the right atrium. Obviously, because of this defect, there is a more pressure in the right atrium. And when the catheter is again advanced into the right ventricle, we will also come to know about the pressure, chamber pressure in the right ventricle. So obviously the pressure the chamber pressure in the right ventricle is also increased. It is because of shunting of blood from left ventricle to the right ventricle. Okay, and we can also do left sided heart catheterizations where the catheter is inserted. Okay, the catheter is inserted from femoral. Okay, from the femoral artery, the catheter is inserted from femoral artery to the aorta. From the femoral artery to the aorta, then the catheter is inserted. Okay, then the catheter is inserted into the what happens? Catheter is inserted into the left ventricle. And once the catheter is inserted into the left ventricle, what happens here? And dye, okay, a radiopaque dye is injected. So once we inject the radiopaque dye, okay, dye, what happens here? The dye will start shunting along with the blood from left ventricle into the right ventricle. So followed by injection of dye, we can take a image by the fluoroscopy. So thereby we will come to know about stenting of blood from left ventricle to the right ventricle, and this will confirm the ventricular septal defect. Okay, so through the cardiac catheterization, by the cardiac catheterization, we can confirm diagnosis of a ventricular septal defect. Okay, so these are some of the diagnostic evaluation of ventricular septal defect. Now we'll discuss about the management of discuss about the management of ventricular septal defect. First one is treatment of anemia. Okay. First one is treatment of anemia. Okay. If the child is having a ventricular septal defect, okay, and if child is also suffering from anemia, anemia has to be treated at the earliest. Okay, because if you do not treat the anemia, it will lead to the child will easily develop congestive cardiac failure. Okay, so that is why we have to treat the anemia as early as possible if it is suffering from anemia along with the ventricular septal defect. How we are going to treat this one? By iron supplement. Okay, iron supplement. We can advise, okay, child to have a nutritious diet. Okay, iron rich nutritious diet. So that may be like it may be jaggery, ragi, green leafy vegetables, groundnuts, beetroot. Okay, so these are the some of the nutritious diet, iron rich nutritious diet that can be advised to the child. Okay, and apart from that, we can also go for blood transfusion. If baby is having very severe anemia, we can go for the blood transfusion. Okay, so this is a basic anemia management of a child. Next one is treatment of respiratory tract infection. Okay, I have already told you that the child is more risk for developing the respiratory tract infection. It is because of pulmonary edema development. Okay, so because of this, we have to treat the respiratory tract infection. How it can be treated? By using antibiotics. Okay, antibiotics based on culture and sensitivity. We can also go for steam inhalation, and we can go for nebulization. So steam inhalation, nebulization, and antibiotic based on culture and sensitivity. So this can be used to treat the recurrent chest infection. Okay. Next, we can use some vasodilators. So this vasodilators, what it does, it will dilate the smooth muscles. Okay, so it will dilate the pulmonary artery pressure. Okay, pulmonary artery, and thereby it reduces the pulmonary artery pressure. Okay, pulmonary artery pressure and pulmonary artery capillary pressure also reduces. Okay, so example is sildenafil. Okay, so we can give vasodilators just to reduce the pulmonary artery pressure. Okay. Next, we can also use diuretics. Example is Lasix or other diuretics can also be used. So this will reduce the edema and it also reduces the cardiac overload. Okay. Now let us discuss what is the surgical management. Okay. This is the medical management. Next one is surgical management. Okay. So we can do closed heart surgeries. In surgical management, we can do closed heart surgery. So closed heart surgery, what we can do in this one? Okay. So this is a heart. And here is a defect. Okay. This is a superior vena cava and inferior vena cava. So what you do here? we insert the catheter, okay, through the femoral vein, okay, through the femoral vein, we insert the catheter, and then catheter is advanced up to the inferior vena cava. Okay, this is the inferior vena cava. So catheter is advanced up to the inferior vena cava, and then catheter is inserted through the femoral through the inferior vena cava into the right atrium, and then catheter is advanced to the right ventricle. It is advanced to the right ventricle, and then what happens here? Here, this catheter should be tipped with one occluder. Okay, so this occluder is passed through this defect. Occluder is passed through the ventricular septal defect, and then what happens? We can open that occluder, and that occluder will fix. Okay, this occluder will fix into the ventricular septal defect, and thus it will close the defect. It will close the ventricular septal defect, and thereby prevent the shunting of blood from left ventricle into the right ventricle. So what we do in the closed heart surgery? We insert the catheter through the femoral vein into the inferior vena cava, then inferior vena cava into the right atrium, then the catheter is advanced to the right ventricle, and then catheter is passed through this defect, and this catheter is tipped with one occluder. Okay, so that occluder is just opened at the defect. At the point of defect, no, it is opened, and it will completely shut the opening. It will completely close the opening, and thus after that the catheter is removed, and thereby it will prevent the shunting of blood from left ventricle into the right ventricle. So this is closed heart surgery. Next, one more we have a open heart surgery. One more treatment is open heart surgery. In open heart surgery, what we do? So the child is put on general anesthesia. Okay, sternotomy, that is the opening at the sternum is taken, and sternum is opened, and then the child is put on heart lung machine. Then direct incision. Okay, direct incision is taken on the heart. Okay, direct incision is taken on the heart. Okay, so direct visualization of this defect is done, and this defect is closed with some patch. Okay, the surgeon, cardiothoracic surgeon, will close this defect with some Dacron patch, and will closes the defect directly, and thereafter the child is taken out from the heart lung machine, and we'll see how effectively it is functioning. Okay, so this is known as a open heart surgery. Okay, to close the defect. Next, what is the nursing management? Third part is nursing management. So nursing management, okay, what we do here in nursing management? First, we have to assign the child. Okay, we have to assign the child activity. Okay, we have to assign the child activity according to its tolerance. According to its tolerance. Next, we have to closely monitor. We have to closely monitor height and weight of child. Okay, height and weight of child we have to monitor. We have to educate parents regarding iron rich nutritious diet. Okay, if the child is planned for any surgeries, then we have to take care of perioperative nursing, that is preoperative, intraoperative, and postoperative care. Okay, so that is perioperative care. Perioperative nursing care has to be given if child is planned for a closure of defect. Either it may be open surgery or closed surgery. But if the defect is very small, it may not require any surgery. It will closes as the age of the child will increases. Okay, so we have to take care of perioperative nursing care. Okay, and we have to have a closed follow up of the child. Okay, follow up child we have to do. Okay, until the child complete problem is solved, complete disease is cured. Okay, we need to closely follow the child. Okay, and we need to give steam inhalation. Okay, steam inhalation we have to give, and we need to give nebulization. Okay, nebulization we have to give, and apart from that we need to give medication as advised by the pediatrician. Okay, so these are the nursing interventions or nursing activity we need to carry out to manage the ventricular septal defect. So this is all about the ventricular septal defect. If you do not understand, you comment in comment box. Thank you for watching this video. Thank you very much.